We are back and continuing to focus on your health, specifically cardiovascular disease. Well, before the big game, I spoke with an NFL quarterback and a doctor all about this subject, about heart disease and more. Let's take a look.
Former NFL quarterback Ron Jaworski is tackling more than just a big game during Heart Health Month in February. While Ron is best known for football and as an ESPN commentator, he also hosts a health education podcast called True to Your Heart. Through this role, Ron has learned much more about cardiovascular disease and issues surrounding it. With Ron is cardiologist Dr. David Strobl, who has some important information for patients who have already had a heart attack or stroke and their caregivers. Thank you both for being here today.
Christine,
Thanks,
great
Christine.
to be with you.
Ron, tell us about your latest projects and your feelings leading up to the big game.
Well, I'm glad you mentioned the big game. I'm glad you mentioned February's Heart Health Month. It's been a very busy time for all of us, which is wonderful. And I can't thank Ameren enough to allow me to be the quarterback of their team with my podcast. And it's been fun doing it, and it's been incredibly educating. I've had some of the finest medical doctors, cardiologists, smart people you would ever can imagine. And I've learned so much from the podcast. And I just want to get the word out there about heart health. And that's what we're doing. And I've learned so much from it. And I'll give you a real life story. About 6 months ago, while I was doing my podcast, my brother passed away. And, you know, it rattled me pretty good. And it made me aware of heart disease and how we can combat heart disease. And I kind of made it personal. And first of all, I went and took care of myself, and I saw my doctor and put together a game plan for my future, you know, with regular exercise, diet, nutrition, weight, blood pressure, less alcohol, no smoking, all those things, formulated my game plan for my future. And so now I take what I've learned from all these smart people, and when I go do my podcast, I'm speaking from the heart. I'm speaking from the medical profession that taught me so much. And I've gotten such an amazing feedback by getting the positive word out to take care of yourself, take care of your heart. So it's really been an enlightening experience for me.
Ron, how did you get involved in the True to Your Heart podcast? And it sounds like you're learning so much from it. Tell us more.
Yeah, I mean, Ameren approached me, and I know the great work they do in the medical field, and it's a little bit out of my zone, my strike zone per se, as an analyst and as a former NFL quarterback. But I've adjusted to it because of the amazing people that we've had on the podcast, and I think everyone's been happy with it. We're going to do season 2, so I think the feedback has been very good, and we're already beginning to line up the experts on heart health that'll be my guest next year. So I'm looking forward to it, doing it again.
Dr. Strobl, what should people who have had a heart attack or stroke know about their increased risk?
Christine, it's kind of scary. People, if they're lucky enough to survive a heart attack, they're still facing years of increased cardiovascular risk, persistent cardiovascular risk, we call it. In fact, one recent study showed that about 50% of patients that already had their first heart attack had another cardiovascular event, whether it be another heart attack, a stroke, or a cardiovascular procedure within a year. So there's some urgency to this. And Ron, to his credit, with the sad news of his brother, took that call to action. And that's what we need to do. We need to identify these patients with the increased risk. Now, Ron did a lot of great things with lifestyle changes. We also want to do things like drive down the bad guy cholesterol, the LDL, drive it down the field. But even if we do that and achieve very low levels of cholesterol, there still is this persistent increased cardiovascular risk. So Ron was a great quarterback, but he sometimes would lean on his defense. And that's what I would suggest, is that we have to be able to know the enemy, know the underlying disease state. We have to find those hidden warning signs and clues of this persistent risk and then address them.
Dr. Strobl, what should people who are in treatment and have options, What should they know about being at higher risk?
So, Christine, I think that what I would suggest for patients is to take charge of their healthcare like Ron did. Know what the risk is, and there's great information, for example, on the TrueToYourHeart.com website, where you can find Ron's podcast as well as other great information to develop that winning game plan, so that you can sit down with your doctor and your family can sit down and ask questions and don't hesitate and punch that ball across the goal line. Don't fumble, right? So that we have to have that sense of urgency.
No fumbles, Doc. No fumbles.
No fumbles. I know, Ron. He wouldn't like the fumbles, but Ron took it serious, and I think I'd encourage people, don't push it back on the calendar. Take advantage of this conversation we're having, and take care of yourself and your family.
You definitely don't want to fumble. Ron, what are some final thoughts you'd like our audience to remember about this issue, especially?
See your doctor. It's not that simple, but my simple phrase is see your doctor. If you can't do that quickly, go to TrueToYourHeart.com. Incredible information from an amazing group of doctors that are at that site.
And where can we get more information?
Go to TrueToYourHeart.com.
Same place. It's easy to find.
Same place.
Yeah, and Dr. Strobl for joining us today. Really appreciate your time and this great information about people who've had a heart attack or stroke, and appreciate your discussion leading up to the big game. Have a great week.
All right. Thank you so much. Be
Thanks,
safe.
Christine.